All right, everybody, welcome back to the deep dive. Today, we're tackling something that's actually way more common than you might think.
Mm-hmm.
Liver cysts.
Yeah.
You know those things you hear about and you're like, oh, that sounds scary, but like, how common are they really?
Right.
Well, get this. In the US alone,
Okay.
5 to 18% of people have liver cysts, and worldwide, the numbers are even higher.
Wow.
So chances are you or someone you know probably has one.
Yeah, probably.
So let's dive into all things liver cysts and break down what they are,
Yes.
what causes them,
Mm-hmm.
what to look out for,
Sure.
and most importantly, how to not freak out if you find out you have one.
Absolutely.
So first things first, what are liver cysts?
So basically, liver cysts are these little sacs of fluid that form in your liver, and they're usually benign, which is a fancy way of saying they're not
Okay,
cancerous.
so like little water balloons hanging out in your liver?
Yeah, exactly. Like little water balloons, and they can range in size from teeny tiny, like a pinhead, to, as big as like an orange.
Oh, wow, that's pretty big.
Yeah, they can get pretty big.
So if they can get that big, why don't we always feel them?
That's a great question. And the answer is that our livers are pretty amazing organs. They're really good at adapting. And oftentimes these cysts don't cause any symptoms at all, so people can go their whole lives without ever knowing they have one.
Wow, so it's like a silent little house guest just chilling in your liver.
Exactly, just hanging out, doing their own thing.
That's both kind of cool and kind of creepy.
Yeah, it is kind of both.
So if most people don't even know they have them, how do they usually get discovered?
Most of the time, liver cysts are found by accident. Someone might go in for an ultrasound, a CT scan, or an MRI for something completely unrelated, and bam, there's a cyst just hanging out on the screen.
So it's like a surprise bonus on your medical imaging?
Yeah, pretty much. And, sometimes it can be a little alarming to see that on the scan, but like we said, most of the time it's nothing to worry about.
Okay, so that makes me feel a little better. But let's talk about the different types of liver cysts, because I know there's more than one kind.
Right. So we have simple cysts, which are the most common. They have smooth, thin walls and are filled with clear fluid, like that perfect little water balloon we were talking about. And then there are complex cysts.
Complex cysts. So those sound a little more complicated.
Yeah, they can be a little bit trickier because they might have thicker walls or some debris in the fluid, or maybe they have an irregular shape.
So those are the ones that might cause some trouble.
Yeah, they're the ones that need a little more attention, but again, most of the time they're still benign. It's just that there's a slightly higher risk that they could cause some problems.
Gotcha. So we've got simple cysts, usually no big deal, and then complex cysts, which we need to keep an eye on.
Exactly.
So what actually causes these cysts to form in the first place?
That's a question that scientists are still trying to figure out completely.
Really?
Yeah, for a lot of folks, those simple cysts we were talking about, they probably formed way back when they were just little embryos developing in the womb. Maybe there was a little hiccup in how the bile ducts were forming, something like that.
Okay, so some of us might just be born with these little water balloons in our livers.
Pretty much. And then there are other cysts that seem to pop up later in life, but the exact causes for those aren't always clear.
Huh. So it's a bit of a mystery.
Yeah, there's still a lot we're learning about liver cysts, but one thing that's interesting is that women tend to develop them more frequently than men.
Oh, really?
Yeah, which suggests that maybe hormones like estrogen could play a role.
Interesting. So maybe those little water balloons are a little more attracted to the ladies.
Maybe, so we need to do more research, for sure.
All right, so we've covered the what and the why of liver cysts now. Let's talk about how do you even know if you have one? What are the symptoms?
Well, like we mentioned before, a lot of people don't have any symptoms at all, especially with those simple cysts. But if a cyst does start acting up or growing larger, there are a few things you might notice.
Like what?
Well, the most common symptom is a dull ache or a feeling of fullness in your upper right abdomen where your liver is located.
Okay, so like a little pressure or discomfort.
Right, and some people might also experience bloating or feel full really quickly after eating, or maybe they even notice some swelling in that area.
Hmm. So nothing too dramatic, but definitely things you wouldn't want to ignore.
Exactly. And it's important to note that there are a few rare but serious symptoms that you should definitely watch out for. Things like sudden sharp pain in your upper abdomen, especially if it's accompanied by fever or yellowing of the skin or eyes.
Oh, wow. Those sound like red flags.
They are. And if you experience any of those symptoms, you need to get to a doctor ASAP because it could mean that a cyst has ruptured or become infected.
Okay, so those are the ones we don't mess around with.
Absolutely. Those are the ones you take seriously.
All right, so we know what to watch out for now. What if you do have symptoms, or maybe a scan shows a cyst? What happens next?
Well, the first thing to remember is don't panic.
Easier said than done.
I know, I know, but seriously, most liver cysts don't require any treatment at all. It's really all about monitoring them and making sure they're not causing any trouble.
Okay, so a watch and wait approach.
Exactly, and if a cyst is causing problems, there are a few things doctors can do to manage it, but we'll dive deeper into the treatment options in the next part of our deep dive.
Perfect. So stay tuned, everyone. We'll be right back with more on liver cysts and what you need to know. And we're back, folks, ready to plunge even deeper into the world of liver cysts.
That's right. We're going to get into the nitty-gritty of how those cysts are diagnosed and what happens if you find out you have one.
So in the last part, we talked about how those cysts often show up on scans like ultrasounds, CT scans, and MRIs.
Right, those imaging tests can be super helpful for spotting those little fluid-filled sacs.
Yeah, but for those of us who aren't doctors, those tests can sound kind of like science fiction. Like what exactly are they looking at?
Well, think of an ultrasound like sonar for your insides. It uses sound waves to create pictures of your organs, and in this case, your liver.
Okay, so it's like those cool underwater pictures of dolphins and stuff.
Exactly. It's the same technology. And with liver cysts, an ultrasound can show the size, the location, and even tell if it's a simple or a complex cyst.
And all that just with sound waves. That's pretty amazing.
It is, and the best part is it's totally painless, and there's no radiation involved.
So it's a safe and easy way to get a peek inside.
Exactly. Now, a CT scan that's a little bit different. It uses X-rays to create super detailed 3D images.
So it's like taking a virtual tour of your liver.
You could say that it gives doctors a much clearer picture of the cysts, their shape size, how many there are, and even what's inside them.
So if ultrasound is like a snapshot, a CT scan is like the whole photo album.
Yeah, that's a great way to put it. And then there's MRI, which is like the high-definition version.
Ooh, fancy.
It uses magnets and radio waves to create even more detailed images. It's especially helpful for figuring out what type of cyst it is and making sure there's nothing funky going on.
So it's like the detective of the imaging world.
Exactly. It helps doctors gather all the clues they need to make the right diagnosis.
Okay, so we've got these different scans, each with its own superpowers, so to speak. But let's say one of these scans does reveal a liver cyst. What happens next?
Well, the most important thing to remember is don't freak out.
Deep breaths, everyone, deep breaths.
Seriously, most liver cysts don't need any treatment at all. It's really all about monitoring them and making sure they're behaving themselves.
Okay, so a watch and wait approach like we talked about before.
Exactly. But if a cyst is causing problems, there are a few things doctors can do.
Like what?
Well, one option is aspiration, which is basically just draining the fluid from the cyst with a needle.
Kind of like popping a water balloon?
Yeah, kind of, but it's a bit more precise than that, and sometimes the cyst can fill back up, so it's not always a permanent fix.
Okay, so it's more like patching a leak in the water balloon.
Right now, if the cyst keeps coming back or it's causing a lot of trouble, doctors might recommend a more permanent solution like surgery.
Surgery, that sounds a bit scary.
I know, but there are different types of surgery, and the good news is the liver is a pretty resilient organ.
Resilient, what does that mean?
It means it can bounce back. It can actually regenerate itself.
Whoa, really? So
Yeah.
even if they have to remove part of the liver, it can grow back.
Exactly. It's pretty amazing. And there's also a procedure called cyst fenestration, which basically means removing part of the cyst wall to stop it from refilling.
Okay, so there are options depending on the situation.
Yeah.
But what about prevention? Is there anything we can do to avoid getting these cysts in the first place?
Well, that's where it gets a little tricky. Remember how we talked about those simple cysts that form before birth?
Yeah.
Well, there's not much we can do about those. It's just part of how we develop. But for other types of cysts, like those caused by parasites, there are definitely things we can do.
Yeah, like those hydated cysts we talked about.
Right. Those are caused by a parasite that can be found in contaminated food or water. So practicing good hygiene, like washing your hands thoroughly and being careful about what you eat and drink, especially when traveling, can go a long way in preventing those types of cysts.
So basic hygiene, it's not just for kids.
Exactly. It's important for everyone.
All right, so we've got hygiene covered. But what about the mental side of things? Getting a diagnosis like this can be kind of scary. How do people cope?
Absolutely. It can be a lot to process, but the most important thing is to arm yourself with knowledge and talk to your doctor.
So instead of freaking out, focus on getting informed.
Exactly. Because when you understand what's going on and you know that most liver cysts are harmless, it can really help ease your mind.
Right. Knowledge is power, as they say.
It really is. And remember, most people with liver cysts live perfectly normal, healthy lives. So don't let a diagnosis define you.
Okay, that's reassuring. But what about the future of treatment? Are there any new and exciting developments on the horizon?
Definitely, scientists are always looking for better ways to diagnose and treat liver cysts.
Like what?
Well, for example, there's a lot of research going on with stem cells and how they could be used to regenerate damaged liver tissue.
Stem cells, those are like the superheroes of the medical world.
They are. They have the potential to revolutionize how we treat a lot of diseases. And there's also ongoing research into even more precise imaging techniques, which could lead to earlier detection and more accurate diagnoses.
So the future of liver cyst treatment is looking bright.
It is, there's a lot to be hopeful about. But before we get too carried away, let's bring it back down to earth and address some of those common questions and concerns people have about living with liver cysts.
Perfect, because I'm sure our listeners have tons of questions.
I'm sure they do, so stay tuned, everyone. We'll be right back with the final part of our liver cyst deep dive.
Welcome back, Dup Divers, for the final part of our liver cyst exploration. So we've covered a lot of ground, but I'm sure there are still some lingering questions.
Yeah, absolutely. There's always more to learn, and it's important to address those common concerns.
Right, because knowledge is power, especially when it comes to our health.
Exactly. So let's dive into some of those burning questions.
All right, so first up, if most liver cysts are harmless and don't cause symptoms, why should we even care about them?
That's a great question. And you're right, a lot of people live their whole lives with cysts and never have a single issue. But here's the thing, even though most cysts stay small and quiet, there's always a chance they could grow or start causing problems.
So it's like having a tiny house guest that could potentially become a not-so-tiny problem.
Yeah, kind of like that. It's better to know they're there and keep an eye on them just in case.
Okay, so awareness is key, but what about lifestyle changes? If you find out you have a liver cyst, do you need to overhaul your whole diet and exercise routine?
Not necessarily for most people with simple cysts. There's no need to make any drastic changes.
So no need to suddenly become a marathon runner and live on kale smoothies.
Nope. A healthy lifestyle is always a good idea, but don't stress about making huge changes just because of a simple cyst.
Okay, that's a relief. What about alcohol? Is that off limits for people with liver cysts?
Again, it depends on the individual and the type of cyst they have, but in general, moderate alcohol consumption is unlikely to cause problems for people with simple cysts.
So everything in moderation, as they say.
Exactly. But if you have complex cysts or other liver conditions, it's always best to talk to your doctor about what's safe for you.
Makes sense. So personalized advice is key.
Yeah.
What about genetics? If your parents had liver cysts, are you more likely to get them too?
Well, it depends on the type of cyst. Remember how we talked about polycystic liver disease?
Yeah, those are the ones with multiple cysts.
Right. Well, that condition is definitely inherited. So if a close relative has it, your chances of developing it are higher.
Okay, so genetics play a role there, but what about those simple one-off cysts? Do those run in families too?
That's a good question, and scientists are still trying to figure that out for sure.
So more research is needed.
Always more research, but there's some evidence to suggest that there might be a genetic component to simple cysts as well.
Okay, so family history is something to keep in mind, but not necessarily a guarantee. What about pregnancy? Can liver cysts affect a woman's ability to get pregnant or have a healthy pregnancy?
For most women with simple cysts, pregnancy is not a problem. But for those with polycystic liver disease, it's important to talk to their doctor because there could be some increased risks.
Okay, so another good reason to have those open and honest conversations with your healthcare provider.
Absolutely. Communication is key.
All right, so we've talked about a lot of the common concerns, but before we wrap up, let's talk about red flags. What are some signs that would warrant a call to the doctor even if you don't have major symptoms?
That's an important point to make because even though most cysts are harmless, it's always best to listen to your body and pay attention to any changes.
So what should we be on the lookout for?
Well, any new or worsening pain in your upper right abdomen, that's a big one. Also, any unusual swelling or any other symptoms that just don't feel right. Those are all reasons to reach out to your doctor.
Well, better safe than sorry.
Exactly. Trust your instincts and don't hesitate to seek medical advice if you have concerns.
Well, that brings us to the end of our liver cyst deep dive. We've explored the what, the why, the how, and even the what ifs.
Yeah.
And hopefully we've armed you with the knowledge you need to feel empowered, not afraid.
Exactly. Remember, most liver cysts are harmless and don't require treatment. And if you do happen to have one work with your doctor, stay informed. And most importantly, live your life to the fullest.
And to all our amazing deep divers out there, thank you for joining us on this journey of discovery. We'll see you next time for another fascinating deep dive into the world of health and science.